Exposure and response prevention, ERP, is a therapeutic approach designed to help individuals suffering from obsessive-compulsive disorder, OCD, break free from the cycle of obsessions and compulsions that often dominates their lives. This evidence-based treatment is rooted in the principles of cognitive behavioral therapy, CBT, and is recognized as one of the most effective interventions for OCD. The essence of exposure and response prevention. Unraveling the OCD cycle. OCD is characterized by the presence of distressing obsessions, intrusive, distressing thoughts or images, and compulsions, repetitive behaviors or mental acts performed to alleviate the distress caused by obsessions. ERP targets this cycle by exposing individuals to their obsessive triggers, while preventing them from engaging in compulsive rituals. Gradual and controlled exposure. ERP involves systematically exposing individuals to situations, thoughts, or images that trigger their obsessions. These exposures are carefully planned, graded from least distressing to most distressing, and conducted in a controlled and supportive therapeutic environment. Response prevention. The response prevention component of ERP involves instructing individuals not to engage in their usual compulsive behaviors or rituals following exposure. By resisting the compulsion to perform these rituals, individuals learn that their feared outcomes do not occur, and anxiety diminishes over time. The therapeutic process. Collaborative approach. ERP is a collaborative process between the individual with OCD and a trained therapist. Together, they identify specific obsessions, compulsions, and triggers that will be targeted in therapy. The therapist guides the individual through exposure exercises and supports them in resisting compulsions. Hierarchy of exposure. ERP sessions are structured around a hierarchy of exposures. This hierarchy typically begins with less distressing triggers and gradually progresses to more challenging ones. This systematic approach allows individuals to build confidence in facing their fears. Real-life scenarios. Exposures in ERP may involve real-life scenarios related to the individual's obsessions. For example, someone with contamination obsessions might touch a doorknob without immediately washing their hands. The therapist ensures that the exposure is safe and manageable. Cognitive restructuring. ERP also addresses the cognitive aspect of OCD. Individuals learn to challenge and reevaluate their obsessive thoughts, recognizing them as exaggerated or unfounded. This cognitive restructuring helps reduce the distress associated with obsessions. The benefits of exposure and response prevention. Symptom reduction. ERP has been proven to significantly reduce the severity of OCD symptoms. Many individuals experience a marked improvement in their ability to manage obsessions and compulsions. Improve quality of life. As OCD symptoms lessen, individuals often experience an enhanced quality of life. They regain a sense of control, freedom, and independence, no longer being held hostage by their obsessions and rituals. Lasting effects. ERP can lead to long-lasting effects. Individuals who complete ERP treatment often continue to benefit from reduced OCD symptoms, even after therapy concludes. Empowerment. ERP empowers individuals to confront their fears and obsessions directly. Over time, they become more resilient in managing anxiety and less reliant on compulsive behaviors. Applications of exposure and response prevention. ERP is primarily used in the treatment of obsessive-compulsive disorder. It can be applied in various settings. 1. Outpatient therapy. Many individuals with OCD receive ERP as part of outpatient therapy. Sessions typically occur weekly, and individuals practice exposure exercises between sessions. 2. Intensive treatment programs. In some cases, individuals with severe OCD may require more intensive treatment, such as partial hospitalization or residential programs, where ERP is a core component of therapy. 3. Self-help. Some individuals may learn ERP techniques through self-help resources, books, or online programs. However, it is advisable to work with a trained therapist for the most effective results. Critiques and controversies. ERP, while highly effective, is not without its challenges and debates. 1. Discomfort during exposure. Exposure exercises in ERP can be distressing and uncomfortable. Some individuals may find it initially difficult to confront their fears. 2. Limited generalization. The success of ERP may not always generalize to all situations or obsessions. Individuals may experience symptom improvement in specific areas, but still struggle with others. 3. Need for skilled therapists. ERP requires a skilled therapist who is knowledgeable about OCD and experienced in delivering exposure exercises. Access to trained ERP therapists can be limited in some regions. The future of exposure and response prevention. As our understanding of OCD and its treatment continues to evolve, ERP remains a cornerstone in the management of this challenging disorder. Future developments may include enhanced personalization, tailoring ERP to individual needs and preferences, ensuring that exposures are highly relevant to the individual's obsessions. Virtual reality. The use of virtual reality technology to create realistic exposure scenarios, providing a controlled and immersive experience for individuals with OCD. Combination therapies. exploring the benefits of combining ERP with other therapeutic approaches, such as medication or mindfulness-based techniques. We are House of Thought Therapy, nurturing minds, empowering lives.